Hello and welcome to Med4 Care. I am Dr. Care and today we will talk about nasal congestion. Let's start right away. Let's start by defining nasal congestion is a very common symptom of various respiratory or allergic diseases and can be described as the sensation of a stuffy nose. This perception can be caused by a mechanical obstruction inside the nostrils or by a condition of inflammation of the nasal mucosa associated with accumulation of mucus. Well, after defining nasal congestion, let's talk a little about its spread. Specifically, most of the studies on nasal congestion have been conducted in patients in whom a rhinological disease condition has been ascertained, such as allergic rhinitis, of which nasal congestion is an almost constant symptom. For this reason, it is estimated that the current prevalence of allergic rhinitis in the world population is about 10% to 20%, almost double compared to previous decades, probably due to the increase in diagnoses due to greater awareness on the part of patients. Inflammation of the nasal mucosa is the key element that explains the origin of the symptom and therefore is the basis of the pathophysiological mechanism that characterizes nasal congestion. In turn, inflammation of the nasal mucosa can originate from the modulation of allergens, interleukins, and other substances that act on behalf of the immune system, or from the pathogenic action of bacteria and viruses. In fact, once the pathogen or allergen penetrates inside the nasal mucosa, the inflammatory cascade starts, which increases vascular permeability, causing edema, engorgement of the venous capillaries and obstruction of the airflow. Let us now go into the pathologies that often include nasal congestion as the main symptom or one of the most recurrent symptoms, and I will now explain which conditions are most commonly observed in association with the sensation of a stuffy nose. The first pathology we talk about is allergic rhinitis, which is a seasonal disease that is constantly increasing all over the world and that mostly affects children, manifesting itself with nasal congestion, nasal itching, ocular itching, and tearing. This condition, which sees nasal congestion as the main symptom, is triggered by an allergic reaction on the part of the host, which reacts to the access in the nasal passages of an allergen present in the external environment. Various allergens have the ability to bind to special receptors located on the surface of specialized cells, known as mast cells. When many allergens bind to their own receptors on the surface of mast cells, the latter degranulate, releasing many of the substances that are then responsible for the actual appearance of allergic symptoms. Rhinosinusitis is the name that includes a set of disorders characterized by associated inflammation of the nasal passages and paranasal sinuses. The most common cause of rhinosinusitis is viral infection. It seems, in fact, that many viruses directly stimulate some inflammatory pathways, which then lead to edema and swelling of the nasal mucosa responsible for the sensation of obstruction. Nasal polyposis is a condition in which the formation of peduncular growths inside the nasal cavities is observed, which mechanically obstruct the flow of air arriving in the nose. This disorder affects up to 4% of the population and is strongly associated with nasal congestion, swelling of the mucosa, and mild impairment of the sense of smell. Let's now pass to the chapter of the diagnosis for nasal congestion. This evaluation is the responsibility of the otolaryngologist specialist, with an otolaryngological visit. He examines the patient, trying to identify the precise diagnosis underlying the nasal congestion. First of all, the doctor carries out a thorough medical history, collecting all the information that he deems useful regarding the general state of the patient, the presence of diseases in progress, and the drugs he is taking in case of therapies. During this phase, the doctor tries to understand the origin of nasal congestion, asking the patient if he suffers from allergic diseases or if he has recently suffered some direct trauma to the nasal bones. The physical examination is based on the evaluation of the patency of the airways and nasal cavities, inspecting and palpating the region of the nose, in order to detect any swelling areas responsible for the perceived sense of obstruction. The actual diagnosis of nasal congestion is purely technical and is based on the estimate of the resistance that the nasal cavities offer to the passage of air during inspiration. Rhinomanometry is the most reliable instrumental examination for the diagnosis of nasal congestion, as it allows to study both resistance to airflow and transnasal pressure. It is based on the insertion of a cannula inserted in the oral cavity and an additional cannula inserted in a nasal cavity, and, through a specific equation, the nasal resistance to airflow is ascertained. In general, an effective diagnosis of nasal congestion is made when the resistance exceeds 0.3 Pascal per centimeter cube per second, although this value can change physiologically in some conditions. Other techniques used to characterize nasal congestion are acoustic rhinometry, which allows you to estimate the small microvascular changes associated with congestion by amplifying a sound recorded inside the nasal cavity. Finally, it often happens that together with these specific tests, blood tests are required to investigate any allergy in progress and skin allergy tests in order to trace the identity of the environmental allergen. There are several types of treatments that can be used to contain symptoms related to nasal congestion. The first strategy is a preventive treatment that is based on avoiding environmental exposure to allergens or to the feces of mites present in the home, as well as to dog and cat hair for those who are allergic to them. There is also a drug treatment strategy that involves minimizing the effects of inflammation that characterizes nasal congestion, first of all by freeing the clogged venous capillaries and, subsequently, by decreasing the expression of cytokines and other molecules associated with inflammation. Some medications offer immediate relief from nasal congestion and include phenylephrine, oxymetazoline, and intranasal corticosteroids. It is also possible to resort, in specific cases, to the surgical treatment strategy, which is aimed at restoring the physiological passage of inspiratory air through the nasal cavities and is carried out in cases where there is a mechanical obstruction to the flow, such as in polyposis. Nasal. We are now at the end of today's video. We hope you enjoyed it. If you found it useful, please support us with a nice like and subscribe to the channel. See you soon on Med4Care.